policy brief really provides an overview and mapping of all the different European Union support tools that are available for member states to improve and strengthen their health systems. What we find is, so the main finding of the brief is that there are many tools. However, they are extremely fragmented, they're difficult to identify, and they're also difficult to combine for policymakers. So there really is scope, on the one hand, to provide a platform or a space where all of these tools are brought together. And so for policymakers to be able to make better use of them and maximize the potential of these tools. But also there is really scope for improving the collaboration, so sharing best practices, speaking amongst countries, and thereby identifying good practices that can be transferred across different health systems.
I was very intrigued when I was listening and also when I was going through the policy brief. It's like Nicole mentioned earlier, it's very important that we see that how scattered all the different tools and instruments are over the EU, which means maybe that there isn't health in all policy after all, I could say, but it makes it very difficult, of course, to find your way in all amongst all these in the diversity of all these tools. And therefore, I think the conclusion of setting up this one-stop shop would be very helpful for everybody, I guess, but definitely also for policymakers, for the authorities. We don't have all the resources available to continuously screen, let's say, into the instruments. So in a way, it will be very helpful to get, easy access and with the questions that we have.
So the role of the observatory in that sense was to connect the available information on European support tools and package it in a way that would be easily understandable by policymakers, and that could be used within the framework of the presidency to also inform the Council conclusions regarding what we might want to do differently or what we might want to do more.